Just starting with administrative and financial services, they've been increased by $922,000. Can you explain a little bit of what the increase in the spending entails?
Weren't expecting an administrative question, so kudos to her for catching us. This is in regards to black belt and continuous improvement initiatives within the department, transfer money in, and also with data and analytics. With most certainly a huge part of that is to COVID, and so some of this money will also be recovered from the federal government.
Can you give an idea how much money comes from federal to how much money is provincial?
99%.
Okay, thank you, Minister. Through the chair, there's been an increase of over $1 million to human resources from approximately 6.8 to roughly 7.9. Would part of this be hiring for any incentives to recruit doctors?
You're actually right. This is money that is, we split the cost between the RHAs and the department for the physician recruitment nursing strategy, and so this is our component.
Perfect, thank you. So the total budget estimate for the health has jumped up by about $156 million, which is really good to see. And I know it is much needed in our healthcare for sure. Out of province hospital payments are down just over $1 million. Can you tell us the reason for the reduction in the budget?
Through you, Mr. Chair, that would be COVID related. Of course, we're trying not to send people out of the province as much, and trying to deal with as much as we can here. So COVID has had that impact.
Public health program service is up by $10 million. Is that for the same reason, or are there different reasons for that?
Through you, Mr. Chair. So that $10 million would encompass the public health COVID response with staff. That's been necessary. Also, the wellness branch was moved from social development into the Department of Health under public health. So that's part of it, and increase in staffing that will be permanent with regards to public health.
The increase in staff for public health, is that something that will stay after the COVID thing, or is that just a part of COVID?
13 positions will remain.
Thank you, Minister. Through the chair, there's been an increase in mental health spending by $2.7 million. I know my colleague has touched a lot on the mental health, so I've been, like I say, checking off the questions as we go. Is the increase happening as a result of planning for the rollout or implementing the interdepartmental addiction and mental health?
Through you, Mr. Chair, that's a very good assumption. It is geared towards the interdepartmental 5-year addictions and mental health action plan. At $5 million is actually that's allocated to the RHAs, and so while we don't have specifics on the actual HRs that will be paying for, but we've given them that allotment to bolster their team.
Okay, and when we talk about mental health and addiction, seems to be, they go hand in hand a lot of the time. We've been trying to hook up a harvest house in Miramichi. We've been working really hard towards that. They've started a board. They have volunteers, a list of volunteers waiting to go, a list of people that would want to work there. It's very established and very well known. Still looking for a building to put it in. Has there any talk, especially we have nothing in Miramichi. I mean, our addiction services of the hospital is great for what it does, but it's outdated by about 30 years now with this opiate and especially crystal meth. Is there any, and I know I've been looking for meetings with some of the buildings, the old senior citizens home and things like that to see, I think your 5-year plan can be done in a few months with the right people behind it, and I think we have a really good start on that. Is there any talk, or has there been any talk, or can there be, I guess, if there's not, towards something like that? With very little money, it's a non-profit, so it's not going to take a whole lot of money from government. Is there anything with that?
Not aware of any talks with the Department of Health. Certainly NGOs are always welcome to submit proposals, and we can certainly have staff meet with them to see what the needs are. I do think it's really important that we work with community, and certainly I have delivered that message not only to the department but to the RHAs, that we ensure that we're utilizing the resources that we can, and ensuring that NGOs are working to our goals and providing funding on that purpose. I'm not sure if there have been conversations with social development, but the staff here are not aware of any conversations with the Department of Health, with the NGO.
I know we put proposals into different departments, so I guess it's just getting to the right one at the right time. So we'll still work on that. According to the Canadian Mental Health Association, the demand for mental health care in the province has seen dramatic jump. So there was 25,000 calls for help in like 6 or 7 years ago, and last year there was 86,000 people, and 117,000 from April to December. So the numbers are increasing, faster than what we can help them, for sure. Has the department considered investing more online services to help ease the pressure, especially through staffing and things like that, to help with this issue?
And we certainly have seen through COVID is the value of virtual care. And the in-person visit is certainly something we would always want to strive for. But during COVID, virtual care gave us an option, and I think allowed people to become more comfortable with the use of virtual care. And so the Canadian Mental Health Association, absolutely, we partner with them, and they help us with Bridge the Gap, which is a virtual program for adults and youth. We also launched Bounce Back, which is a comprehensive interactive program, and it's monitored by family and primary caregivers. So, and also I think it's important to note that with our walk-in clinics, we, although we are unsure, what the capacity needs are going to be, but we do know of the success of the early launch of the Campbellton model, and Fredericton will be next. But we also know that at times, if our counselors, whether they be social workers or licensed counseling therapists, if their time is being used and someone comes in, we may be able, we look to put in virtual connectors, so that if someone in another part of the province is available, we can put someone in touch with someone right away. Because I think we know that the sooner we deal with mental health challenges and mental health illness right away, especially when someone is at crisis or near crisis, we have a better risk, or we have a better chance of success when we can see them at that lower acuity. And virtual care is certainly going to be a part of that.
Thank you, the minister, through the chair, for that. And yes, the virtual care, when I worked at the hospital, we had oncology patients that got to see their oncologist in Moncton, and it's just like being in the same room with them. They were able to talk. And in trauma, we had our heart and stroke, and somebody comes in with a stroke, they can get care right away. So when you talk about, especially teenagers and, young ones that are starting to find their way, and you talk about in a crisis state, and getting help right away it literally make the difference, between life and death. So when we see the value of virtual care, and even more so now through this pandemic of not being able to travel and things like that.
But it's certainly a very big focus of ours to understand what's the appropriate level of virtual care, and how do we use it. And so we know now that through the COVID reality. 80% of our family physicians utilized virtual care throughout this pandemic. And so we know that it's made access possible, but we also need to talk, and I think now as we've gotten a little bit of time behind us, and the comfort with virtual care is better. I think we also have to know what is the appropriate care. We know that that's a conversation at our health workforce tables as we speak. It is something that we're always, we need to progress those conversations to know that accountability is there for the care that people are receiving and for the information that the caregiver is using. We've also seen an uptake with our specialists, and we think that there's probably even more room for specialists to do post-op and pre-op assessments and consultations. And those conversations are ongoing. But for me, it's all good, but we must assure that we have accountability and that in the end, is the patient getting the best care that they need? And so for me, it's that needs to be part of this conversation, and we'll work with our associations to put those measures in place and to have those conversations about how we can improve the services that we're delivering.
The CMHC says that more training needs to be provided to doctors and nurses who don't recognize the differences and a lot of the manifestations of mental health. So, like you say, sometimes they're with appropriate care. When you talk about appropriate care, sometimes it's harder to give that. Would you agree that more mental health care training needs to be given to the doctors and nurses in the province? And is there anything going towards that?
Through you, Mr. Chair, to the member. I think the good news is that medical professionals, law enforcement, all agree that the best thing we can do in the delivery of mental health and addiction services is for everyone around the scope of that practice is that we have mental health training and trauma-informed training. And so I think you'll hear more about that in the coming days and in very few weeks as we are working on crisis intervention and the focus that we've put on it most recently. The other thing is that most of the medical professionals have training budgets, and so we will do all we can to promote the heighten the interest for mental health training for all of our associations, whether it be the MBMS or the Nurses Association and all of the people, law enforcement, that we utilize in the delivery of care and intervention. And so we want that intervention to be as positive as possible. I'm also just going to take a moment to let you know that we've been kind of communicating back and forth with SD to understand about your Harvest House question. And so just so you know, we have someone in our mental health and addictions department who is communicating with SD, and there will be an invitation to meet.
Thank you for that. Thank you for working as we talk. The mental health associations and advocates say low to moderate cases can be helped through education and community-based programs, especially with kids, and will reduce the visits to the ER, which would allow more acute cases to be helped in the ER. Low to moderate cases are placing a huge strain on the system, and a lot of times when they go to ER, they're not being helped properly or sent away for referrals and things like that. Would you agree that there needs to be more invested in mental health at the community level so people don't end up going up to the emergency rooms where they could get health and get help somewhere else? And is there anything, in the budget or anything being done to work towards this?
Yes, we've chatted about it earlier, but I'm very happy to review this because I think it's really important and an important step in our province. I'm quite proud of the interdepartmental 5-year action plan for many reasons. One is is that I have maintained from my time in government that no one department can assume the responsibility of something, one, like childcare, and two, like mental health. It must be a shared responsibility. And so even though maybe the major part of a budget might exist in one department, we must work hand in hand with our sister departments to ensure that we deliver the care seamlessly. And so I'm very proud of the 5-year interdepartmental addictions and mental health action plan, because I believe we've taken a huge step in achieving that synergy. We know that we need to support our ERs, and I couldn't agree with you more than knowing that we must have earlier intervention, prevention and earlier intervention. And we can really have such great success, I believe, in treating lower acuity mental health needs. And I use the Campbellton Walk-in Clinic as an example, of which we will have 14 around the province by the time we're done, which will be later this year. And the first 6 weeks in Campbellton, which actually started in December, mid-December, I believe, and in its first 6 weeks, it saw 97 actual walk-in appointments. Of those 97 appointments, 94% on follow-up were very satisfied with their one session and didn't require further intervention, and the rest went on. And the wait list of 37 in the zone was eliminated. That's cooking with gas, as far as I'm concerned. And that helps to spur us on, and actually created an excitement throughout the network in other communities of saying, me next, me next, me next. So they're ready to go, and Fredericton will be next. And we're working on those, and in the budget we have FTEs associated with that, and those are in the works now. So the walk-in clinics, I think, are a huge part of supporting that lower acuity of need. And then in the coming weeks, we'll talk about the crisis care and near crisis care that we will be improving on. And the other thing is in community. And I think this is so important when we're dealing with mental health and addictions. It's one of the reasons I fully supported the decision to move the Campbellton Youth Center to the Moncton region and to make it smaller. Because ideally, we must have a network of excellence. We need to use our communities as much as possible. We need to keep families closer together. We need to keep family support as close to a patient as we can. So that's also going to involve our community organizations. And so this partnership has to be maximized to its full potential. We have to align our goals, and we have to ensure that the outcomes we're looking for are there. And so I see that partnership not only continuing, I see potential for growth. And I think that as we progress through this next year, I think we're going to see many opportunities, absolutely, to accelerate that 5-year plan. And I believe that it's overdue. And I think we all have this little, let's get to it. Let's just do it. And that's certainly where I am, and I know the department is.
No, and I agree 100%. Many meetings that we went to and many people that you talk to, they talk about gaps in the system. From even with its own, like when you were in social development, if somebody wants housing, then they have to go to this, and then they want mental health, they have to go through a whole ordeal again, and then they want something for addictions, which is, linked to mental health, but you have to go through a whole ordeal again. So I think the bridging of the gaps is a huge thing. So when you have all the departments working together, it's can't help but make, better treatment and better decisions for everyone. And mental health just seems to be such you see the pivot in age. I was at the ER for 9 years, and the difference from, early 20s to 30s down to like 13, 14 coming in with suicidal ideation and addictions and attempted suicide is just scary beyond measure. And we've seen such a change in just a short time. And now with COVID and the mental health and all this, it just seems to add to that even more. When we talk about mental health for kids and young teenagers and even young adults, I guess, how many psychologists are in New Brunswick now that are working? And how many are specialized, if any, with, or are they all with kids and young adults?
Through you, Mr. Chair, I have to apologize. We do not have the number of psychologists because there would be some private and some within the healthcare system. We don't have those numbers quantified for you. But what I can say is this, and we'll work to get those numbers for you. What I can say is that we have the psychologist recruitment strategy, trying to make the public workplace more amenable to recruiting of psychologists. And we are also looking at other allied health professionals, and I know that certainly in this last year, as we've been working on the mental health and addictions action plan, even going back to when I was first invited to the table, in 2019 for this, late 2018, with licensed counseling therapists. And as I've talked about earlier, we've included four licensed counseling therapists in the budget this year to bring on board, and with the intent that could be expanded. I also want to speak to integrated service delivery. And of course, as you know, that's a partnership between social development, education, and health. And I have spoken with my colleagues in those two departments, and we're going to be taking a deep dive into ISD over the short term so that we can ensure that those services are readily available and at the level that they need to be.